Yeah, for virtually every county, the county public health director and the public health department are responsible for putting out that information for each individual county. And the state, of course, receives information like that. And we're looking to put up more information, such as what you're suggesting. I would just say back to you, Amy, that I would appreciate it if you would spend a little more time promoting people wearing masks, promoting people doing the right thing in this very difficult time when people are dying and getting sick, and a little less time sort of ginning up the idea that this is a hoax or giving people a platform for the idea that this is some sort of conspiracy. I just want to point out every day, no, you ask question after question, let me answer you. Question after question is always about trying to find something that might have been done wrong along the way. And the reality is we're all trying very hard to get this right. All across the country, every state is fighting this right now. Can you not see that? That COVID is rising everywhere. Let's not try and find the loopholes here and there, but instead find ways that we can promote safety and health. Yes.
Governor, can we talk about the restrictions being imposed on Chicago? And if we can go over again what the metrics were to reach that, because
Sure.
as you pointed out, it was different than it's been for the rest of the state. It sounds like it was similar to Cook County, where it has to do with an increase in the number of days of positivity and also hospitalization.
Correct.
If we can go into that, and also have you already spoken to the mayor about all of this?
Yeah, I've been in contact with the mayor. Let me go back to the basic question you asked, which is there have always been, from the very beginning of our resurgence mitigations, two ways that a region might go into those resurgence mitigations. One, which is the one I frankly thought was the less likely one to trigger mitigations when we first put them in, just my own opinion. And that was the 3 days in a row of 8% positivity. At that time, 8% seemed like we're not going to get there. That's, we're so far away from 8%. And so I just didn't expect that would be the one. And instead, I thought that, the more likely one would be that there would be an increase in hospitalizations on a consistent basis and an increase in positivity rates, but not necessarily triggering 8% 3 days in a row. So what do you know? The very first several regions triggered the 8% 3 days in a row. So it seems unusual now, right, that we have our first one now that's triggered the others. What are those metrics? 7 days out of 10 of increased hospitalizations and 7 days out of 10 of increased positivity rates. So in other words, and this is again a little bit from the modelers, a little bit from the epidemiologists, that when you see a consistent upward trend like this in those two metrics, what you're seeing is that you're probably going to continue in that direction unless you do something more to bring down the positivity rate, bring down the hospitalizations. You've got to put some mitigations in place to try to, flatten that upward direction and bring it back down again.
Maybe this is a question for Dr. Ezike, but I guess in Chicago there's been a little bit of a lull into, it's the suburbs where this is resurging and we're still doing really well. And it wasn't until maybe the last couple of days that there was a sense of, wait, it's starting to catch up. When did you start getting worried about the city of Chicago?
I just want to answer one part of that, and then I'll get out of the way. And that is that I'm hoping that people are looking at the metrics frequently, especially people who are in leadership across all of the cities, towns, counties that are affected. And if they had been watching, Chicago has been on an upward trend. I think we heard this from Dr. Arwoody earlier today and has said this for a couple of days, that actually the upward trend has been going on for some time now. So it shouldn't be a surprise to anyone who's been following the metrics to see that this was a direction and potentially a likely thing that would happen. Having said that, so the data is available for people to look at, so they shouldn't be surprised. Having said that, I'll turn it over to Dr. Ezike.
Sure, I think you've covered it. Again, we publish the metrics for each of the 11 regions like every single day. And if you go back in time, I'm trying to rewind. 4 weeks ago, the statewide average was 4.5. So for us to have gone from 4.5 to nearly 7.5 in just 4 weeks, again, we were at 5%, I think October 7th, we were at 5%. So we're talking about in a matter of 3 weeks, less than 3 weeks, we've gone from 5 to over 7. So the rate of climbing is very significant. And again, people want to poke holes in stats. You can't deny people in the hospital with COVID. You can't deny people who have died with it. So all of these metrics are moving in the same direction, which really validates that this test positivity really does give you that inkling. And the fact that the test positivity goes up is followed by cases going up, followed by hospitalizations going up, followed by deaths. And that's the trend, the trajectory that we need to turn around.
Dr. Nzike, can I ask you about the mental health aspect of this? Cook County, there have been 5 deaths, 19 younger from COVID. All of them have comorbidities. But we've had 23 suicides. A girl threw herself in front of a train the other day because they can't do theater, they can't go to school, they can't play their sports. And what about the mental health aspect of this? It has to be addressed. The Lexington brothers, their beds are full. I mean, we all know people that have suicide or had drug overdoses and heart attacks because of them. How are we going to address that? And we need more hospital beds for that aspect of this.
We absolutely do. The whole world is traumatized. This is a traumatic event that we are all facing together. And so I am not disputing anything that you're saying. Mental health is part of our physical health. We've always known that we have a lack of mental health providers of different backgrounds. Some of the communities that need it most have the biggest dearth. So I think we're on the same page with that. I think the fact that people are committing suicide is a testament to the amount of mental health exercises and first aid, mental health first aid that we all need. I would also suggest, again, not being able to talk to people who have passed on from suicide. There are many things that are going on. This is a frustrating time. I would also suggest that as we try to minimize the deaths, I can tell you that people who have lost a loved one to COVID are also traumatized, and they probably feel just unbearable grief and have thought about committing acts of harm. So everything that this virus has caused pain, has caused mental anguish, and I think unfortunately some people have dealt with it. Like you may have said, there could be many other things going on. There could be underlying conditions of mental health that have not been addressed. But we all need some mental health first aid, and we all need to try to take care of ourselves and our neighbors as best we can.
One more question?
I'd like to just respond to one aspect of that. Look, every life lost is, especially to suicide, but every life lost is one that we should be mourning. And suicide is the most bewildering, I think, for many people. I know that as of a few weeks ago, the suicide numbers in the state of Illinois have not changed year over year in any significant way. That doesn't mean that we shouldn't continue to watch it, and it doesn't mean that there isn't somebody out there that because of the trauma that they're experiencing in this moment and some other mental health challenge that they have, didn't work together to have them decide that they would commit suicide. But it is something that we ought to be watching. And mental health treatment is something we weren't doing well across the state of Illinois, in my view, before we got to COVID. For many years, in fact, we haven't had enough beds available for people or enough treatment available for people who are suffering from mental health challenges. We've got to put it on the same level as we do physical health. There's no doubt about that. So we've continued to try to do that in my administration broadly, but especially in this moment, I think we should be on guard and watching to help people who are suffering. One more question I heard. We're gonna, yeah.
Dr. Zitterberg, a question?
Sure.
Hello. Good to see you again. Dr. Rush told me that there are more hospitalizations, that's true, but they're not as severe as the first wave because we have better therapeutics. Is that what you're seeing at your hospital and other hospitals in the area?
We definitely have better therapeutics now than we did back in March and April. We have drugs that we can use. We have drugs like remdesivir and dexamethasone, convalescent plasma that all help. They're certainly not magic bullets, but they do help to reduce the severity of the disease. However, the key is to not have someone need to come in the hospital. How do we prevent hospitalization? By preventing the disease. Because once you come into the hospital with COVID-19, even though we do have better therapeutics now than we did before, you're still at risk for dying. And not only, as I mentioned before, not only dying, but also living with complications of COVID-19, which could also be quite severe.
All right, thank you, everyone.